Good day everyone, my name is Camille G. Upao and together with Mr. Rob Allen Madrid, we are going to discuss RH and ABO incompatibility. First, we are going to discuss the RH incompatibility. First, we have here the human blood group. We have here the different blood groups, blood group A, B, AB, and O. The blood group A has a antigen on the red blood cells with anti-B antibodies in the plasma, while the blood group B has B antigens with anti-A antibodies in the plasma. The blood group AB has both A and B antigens but no antibodies. And blood group O has no antigens but both anti-A and anti-B antibodies in the plasma. The RH incompatibility, it is also known as the RH disease. It is a condition that occurs when a woman with RH negative blood type is exposed to RH positive blood cells, leading to the development of RH antibodies. It can occur by two mechanisms. The most common type occurs when a RH negative pregnant mother is exposed to RH positive fetal red blood cells, secondary to fetal-maternal hemorrhage during the course of pregnancy, from spontaneous or induced abortion, trauma, and invasive obstetric procedure or normal delivery. And the RH incompatibility can also occur when an RH negative female receives an RH positive blood during transfusion. And this is the reason that the blood banks prepare using blood type O negative or type O RH negative as the universal donor type in emergency situation when there is no time to type and cross-match and physiology of blood. We all know that the blood, it is a river of life that surges within us. It transports everything that must be carried from one place to another within the body. For example, the nutrients, the waste, and the body heat through the blood vessels. Long before the modern medicine, blood was viewed as a magical because when it drained from the body, life departed as well. Blood, it is a circulating tissue composed of fluid, plasma, and cells, and the cellular components of blood are erythrocyte, the red blood cells or RBC, leukocyte, white blood cell or the WBC, thrombocyte or the platelets. By the volume, the RBCs constitute about 45% of the whole blood, and the plasma is about 54.3%, and the white blood cells about 0.7%, and the platelets make up less than 1%. Although it is consists of cells suspended in fluid, blood is still considered a tissue as it is technically a type of extracellular matrix. And the blood enables transport of cells, molecules between parts of the body, and like oxygen, carbon dioxide, and glucose are among the most vital molecules transported in blood. And the blood cells are essential for normal metabolic and immune system function. The red blood cells or the erythrocytes are these measuring about 7 to 8 micrometers in diameters. It contains hemoglobin molecules which bind to oxygen so it can be transported to tissues. And the mature RBCs lack a nucleus and organelles and have non-nuclear DNA. The RBCs and endothelial vessel cells and other blood cells are also marked by glycoproteins that define the different blood types. The ratio of RBCs to blood plasma is referred to as the hematocrit and is normally about 45%. The combined surface area of all red blood cells of the human body would be roughly 2,000 times greater than the body's exterior surface. Next is we have here the leukocyte. The leukocytes are usually larger in size, 10 to 14 micrometers in diameter, than red blood cells. They lack hemoglobin but contain organelles, a nucleus, and a nuclear DNA. WBC or the white blood cells are the main functional component of the body's immune system. They destroy and remove all or aberrant cells and cellular debris as well as attack infectious agents or pathogens, and foreign substances. There are several different types of white blood cells. We have here the basophil, eosinophils, neutrophils, monocyte, natural killer cells, and B and T cell lymphocyte, macrophages, and dendritic cells, all of which perform distinct function. The thrombocyte or platelets, it measures about between 1 to 2 micrometers in diameter. These membrane-bound cell fragments lack nuclei and are responsible for blood clotting or the coagulation, and they result from the fragmentation of large cells called megakaryocytes, and which are derived from the stem cells in the bone marrow. Platelets are produced at a rate of 200 billion per day, a progress regulated by the hormone thrombopoietin, and the platelets contain mitochondrial DNA but no nuclear DNA. Pathophysiology. The firstborn is not usually affected unless the mother had previously undergone an abortion. And during the third stage of labor, when the placenta is being delivered, the maternal and the fetal blood mixes, and the mother's body is synthesized against the baby's blood. So, once na magkaroon ng sensitize, it takes approximately 1 month for Rh antibodies in the maternal circulation to equilibrate in the fetal circulation. So, 90% of the cases, ang sensitization nag-o-occur siya during the delivery. And therefore, most firstborn infants with Rh positive blood type are not affected because yung short period from first exposure of Rh positive fetal erythrocyte to the birth of the infant is insufficient to produce a significant maternal immunoglobulin antibody response. So, ang risk and severity ng sensitization nato is nagre-response increases with each subsequent pregnancy na nag-i-involve ng fetus with Rh positive blood. So, kapag yung mother is nag-conceive again and the fetus is rhesus positive, so, ang antibodies nato is magsisirculate na into the mother's blood and magkocross siya to attack the rhesus positive genes in the fetus. So, the second pregnancy with an Rh positive fetus often produce mildly anemic infant. So, yung whereas the succeeded pregnancies produce more seriously affected infants who ultimately may die in utero from massive antibody-induced hemolytic anemia. A mother has no sign of Rh disease, but the symptoms may be associated with a yellow coloring of amniotic fluid. The baby may have a big liver, spleen, or heart, and jaundice. It is the hemoglobin is converted into bilirubin, which causes an infant to become yellow. And hemolysis, it is a destruction of the red blood cells with the release of free hemoglobin into the infant's circulation. And the hydrops fetalis, it is the massive fetal red blood cells destruction. For the diagnostic test, we have here for maternal blood, the Klein-Heyer-Bethke test or the flow cytometry or the indirect Coombs test. For fetal blood, we have here the direct Coombs test, blood count, and bilirubin, the direct and the indirect. For the management, the treatment focuses on preventing the effects of the incompatibility, usually in the baby. The baby can be treated after birth with a series of blood transfusion, hydrating fluids, electrolytes, which are elements that regulate the metabolism, and the phototherapy. The phototherapy involves keeping your baby near fluorescent lights to help reduce the bilirubin in their blood, and these procedures may be repeated until the Rh negative antibodies and excess bilirubin have been removed from your baby's blood. And whether it must be repeated depends on the severity of your baby's condition. We have here the nursing diagnosis, the deficient knowledge related to unfamiliarity with information resources, as evidenced by inaccurate follow-through of the instructions. For the nursing intervention, we have to provide explanation and reason for test procedures and preparation needed, and review disease process and prognosis, discuss hospitalization and expected treatment as indicated, and also we have encourage questions and expressions of concerns. The drug Rogam. The generic and brand name is Rogam. It is immunizing agents for classification in a form of vial, and the color is clear. The dosage is 300 mcg. The route is intramuscular. And the action of this drug is it helps prevent the production of antibodies or the Rh sensitization of the mother during the pregnancy It can lead to hemolytic disease of the fetus and newborn in the future pregnancies. Indication of this drug is an immune globulin indicated produced in preventing Rh immunization for pregnancy and other obstetrical condition in Rh negative women unless the father or baby is conclusively Rh negative. The nursing consideration is we have to assess the client condition before and regularly thereafter. And during, we have to inform the client to report early signs of hypersensitivity, hives, generalized urticarial tightness of the chest, wheezing, hypotension, and anaphylaxis. And after is we have to observe the client for 20 minutes after injection, and we have also to evaluate the client's knowledge about the drug. Prevention, the Rh incompatibility can be prevented with Rh immunoglobulin as long as the medicine is given at the correct time. Once the mother has formed Rh antibodies, the medicine will no longer help. And a woman who has Rh negative blood must be treated with Rh immunoglobulin during and after each pregnancy or after any other event that allows her blood to mix with Rh positive blood. And early prenatal care also can help prevent the problems linked to Rh incompatibility. For example, the doctor can find out early whether mother is at risk for the condition. And if the mother is at risk, doctor can closely monitor pregnancy, and he or she will watch for signs of hemolytic anemia in baby and provide treatment as needed.
This part of the reporting will take you through the discussion of ABO incompatibility as related to the Rh incompatibility. Blood is made up of different components, and these are the RBC, WBC, platelets, and the plasma. Blood groups are then identified through the presence of antibodies and antigens in the blood. Now, antibodies are proteins found in plasma which serves as a natural defense that identifies foreign substances and sends signal to the immune system to destroy these substances. Then, antigens are proteins found on the surface of the red blood cells which serves as the indicators or markers. And we have the four main blood groups. First is blood group A, which has the A antigens on the RBC and anti-B antibodies in the plasma. Next is blood group B, which has the B antigens with anti-A antibodies in the plasma. Blood group AB has both A and B antigens but no antibodies. And blood group O has no antigens but both anti-A and anti-B antibodies in the plasma. For the definition of the ABO incompatibility, it is the reaction of the immune system when two incompatible blood types meet through transfusion. This is the most common maternal fetal blood group incompatibility and the most common cause of hemolytic disease of newborn or HTN, and is more likely to occur to newborns with blood type A or B which reacts to type O mothers. Now, these are the types of ABO incompatibility. A mother with type A blood will react against a fetus with type B or type AB blood. Then a mother with type B blood will react against a fetus with type A or type AB blood. Then a mother with type O blood will react against a fetus with a type A, type B, or type AB blood. And a mother with type AB blood will not react against a fetus with type A, type B, type AB, or type O blood. The anatomy and physiology. Blood is a specialized body fluid. It has four main components, which are the plasma, RBC or WBC, and the platelets. And blood has many different functions, including number one is to transport oxygen and nutrients to the lungs and tissues. Number two is to form blood clots to prevent excess blood loss. Third is to carry cells and antibodies that fight the infection. And then next, bringing waste products to the kidneys and liver, which filters and clean the blood. And lastly is they regulate the body temperature. And the components of the blood are the following. First is the plasma, which is the liquid component of the blood composed of water, sugar, fat, protein, and salts. Its main function is to transport blood cells throughout the body alongside nutrients, waste products, antibodies, hormones, and other proteins. Next is erythrocytes or the red blood cells, the most abundant cell in the blood group, comprising about 40 to 45% of its volume. And its main function is to carry oxygen from the lungs to the rest of the body and then return the carbon dioxide from the body to the lungs. Next is leukocytes, or the white blood cells, which is much fewer than the RBCs, which is only about 1% of the blood. Its main function is to protect the body from the infection. Then platelets, these are not actual cells but small fragments of cells. The main function of platelets is to help the blood clotting process or coagulation by gathering at the site of injury, stick to the injured blood vessels, which results to coagulation or forming a platform of platelets. The pathophysiology of ABO incompatibility. Through transplacental transportation, maternal isoantibody reacts with the antigen on the RBCs of the fetus. The isoantibody will pass through the placenta during pregnancy and will be transferred to the fetal blood through the umbilical cord. The isoantibody from the mother will bind to the fetal antigens, which then results to agglutination. Splenic macrophages will recognize the Fc receptors on the isoantibodies, then hemolysis will occur, causing anemia. Another condition that results from hemolysis is jaundice. After hemolysis, hemoglobin is broken down to heme and globin. Heme contains a waste product called unconjugated bilirubin and is taken to the liver or to the placenta, which directs it to the fetal blood, resulting to physiologic jaundice. For the signs and symptoms, these are the following signs and symptoms: fever and chills, breathing difficulties, muscle aches, nausea, chest, abdomen, or back pain, blood in urine, and especially jaundice. And diagnostic tests, first is CBC, or the complete blood count. It is a group of tests that evaluates the cell components of the blood. Then second is the Rickhome test, a test done to find antibodies that are attached to the RBCs. And lastly is blood film, also called the peripheral blood smear. This is done to prevent or to determine the presence of spherocytes in the blood cord. For the medical and surgical management, for the usual treatment that is used for ABO incompatibility, it is phototherapy due to the presence of physiologic jaundice, and in rare occasions, the patient will need an exchange transfusion. And for the diagnosis, altered nutrition related to decreased hemoglobin as evidenced by physiologic jaundice. And nursing interventions are the following: monitor the hemoglobin, hematocrit, RBC counts, and reticulate counts. Assess and monitor the newborn skin to manage jaundice. Provide phototherapy for the newborn. Anticipate the need for exchange transfusion. Discuss with the parents the condition of the newborn and how this happened. And provide specific instructions to the parents in managing the newborn, especially about the nutrition. For the medications, there is no specific medication to be used in this condition, as well as with the prevention, there is no existing preventive measure for this condition.